Session.
Yeah, I'm here, I'm sorry, go ahead.
Okay, cool, awesome, I'm glad you're there. Is it okay if I start?
Wait, yes, please do.
Okay. All right, so on your blueprint, you have 5 questions about alterations in gestational diabetes. Well, we talked about the different alterations in the different systems, so if we know what's normal, what to teach your clients, and what's abnormal. And then what do we do for gestational diabetics? We talked about some specific things that occur as the pregnancy progresses and stuff. Any questions about that? Okay, then the next thing is antepartum assessment. Well, what are we doing in those prenatal visits and those antepartum assessments? What are we assessing? There's specific things we look at, and that we check, we monitor. And then education, same difference. What are we teaching our clients? Are we teaching them like what's normal and what's to report and things like that? And what would be included in early pregnancy, in late pregnancy? What would we include in your teaching?
The Tdap, prefer them to get it before pregnancy, correct? Is it safe to give during pregnancy?
It is the one thing that's safe to give during pregnancy. So, but if they haven't had it, we would definitely want to give it to them before they leave the hospital. Also, we encourage the fathers or significant others to have their Tdap as well. Just think about what that covers, the Tdap. Complications of pregnancy. We talked about infection, bleeding things, anything that's not normal that can interfere with our growth of our fetus, or with our pregnancy being, continuing to full term. We have 6 questions about complications. And then down at the bottom, look at your medications.
I think somebody had a question.
Does somebody have a question?
Yes, I do.
Sarah?
I have a random question about, I noticed some of the treatment for, some of like the sexually transmitted infections with penicillin. Is there anything we have to like know if our patient is allergic?
Not to give it. I'm joking. Of course not to give it, but recognize they have that. And you might alert your provider, hey, I noticed she has a penicillin allergy. Is there something else, that we can give for this, okay? That's the kind of the go-to, is penicillin. But then if they're allergic, we would, definitely go to something else. Or anything that's related to penicillin, So medications at the bottom. You might have some priority questions for me. You might have some pharmacology, nutrition, diagnostic tests and procedures. We talked about some specific tests that we do. That's about it for me. Does anybody have any other questions for me specific?
Well, it does all talking about the vaccine.
Let's talk about, okay, so the first one is talking about the
On the
safety and
blueprint, that's
security
all
lecture,
talk
and
about
there are
that.
4 questions about it.
Is that talking about the
Going back to
vaccine?
that time period, we're talking about how we're gonna keep the newborn and the child safe. So on the newborn, remember I told you there are elements that we have to take that first breath, and we've gotta keep them warm. So just know that. A newborn and pediatric hypoglycemia and hyperglycemia, there's 3 questions. So for the newborn, we talked about issues of their blood sugar dropping because of different conditions with the mom, if she was diabetic, if, excuse me, if she didn't control diabetes, if it was a large baby. So those are some things that can cause hypoglycemia in the newborn. Hyperglycemia, we did cover in the newborn, but it's mostly because they're being treated with D5 and their bodies can't take it when they're little bitty. But for childhood hyperglycemia, we talked about diabetes. So just know about your diabetes and how we're gonna treat it.
The owner has a question.
Yes,
It was for Mrs. Chester. We just,
okay.
we
We
couldn't
couldn't get
get,
there in time.
well, yeah, we couldn't get the mic working.
I hear you.
Okay.
Unacceptable.
Sorry. So on, last lecture before this, we talked about the age of viability. The book on page 128 says 20, and lecture we talked about 24. I think pretty much all the evolved questions, the test we just took, everything goes with 20. So, and I posted it on Blackboard. I just wanted to get clarification.
I'm
It-
sorry, but I've seen a lot of 20-week infants, and I don't think there's any way they're viable. From experience, and I don't think there's gonna be a question that asks specific to that.
Okay.
That's gonna deal, your weeks gestation is gonna deal more with when you do that GTPAL, or with when can you hear fetal heart tones, or when do you know, things like that. Not necessarily with viability, okay?
Okay.
Just
So go with
recognize that it's different, it just depends, are their dates accurate? Are they actually 20 weeks, or are they 22, 23 weeks, There's so many factors that can play into that, all right? But I don't think you're gonna have a question that says, is this infant viable? So, okay?
Okay, and go with the book
And
on
just
the
know that if you look that up, there's probably gonna be several different opinions on that particular topic. If you Googled it or, whatever, there's gonna be differing opinions.
Okay. All right, thank you.
You're welcome.
Oh, hang on, we have another one. What? Ms. Briggs, can you go back to the infant care and assessment, ours cut out here in Stillwater?
Oh, yes, so the infant care, we talked about, they need to be able to take that first breath, and we need to keep them warm. So look back over your notes. Remember what I said about keeping them warm and how we're gonna do it. And then, since there's 4 questions, let's see, newborn care and assessment. Oh, I didn't get that one, I'm so sorry, I didn't get the newborn care and assessment. Yes, I did, that's what we're talking about, okay, and assessment. So what are you gonna do when you get to the assessment of the baby? There's 4. So we're looking at different, how do you say it without giving away a test question? It's like, just go back to the notes, we talked about the different, you don't have to know everything about an assessment on the newborn. You don't have to know, we look for anything unusual, we do an assessment, we do the Ballards, we do an APGAR, Here we go, we're getting it, okay. So, and then we got down to newborn pediatric hypoglycemia. We talked about that, how the newborn can drop their sugars because mom was giving them a lot of glucose and now she's not. So there's different things that can cause, so we check their blood sugar and we feed them. The hyperglycemia is more towards the juvenile diabetic, or the diabetic, because infants don't necessarily have high blood sugar unless they're just not able to handle the D5 that they're getting. So when you look at a disease, or even like down below it, it has cleft palate, reflux, and pyloric stenosis. So if you will look at all of those, and when you look them in your notes, you need to know 4 things. You need to know what it is. So can you define it? And I like to tell students, if you can define it in 1 sentence, you know enough about it. But make sure you're matching the definition with the book, so that you're not just making it up in your head. But look at the definition in your book, and if you can define it in 1 sentence, that's all you need to know about it, because we're not going to be diagnosing, we're going to be doing nursing care. So you need to know what it is, you need to know what it looks like. So what are the clinical manifestations? If I were to see a child or a baby with one of these diseases, what is it going to look like? I would write that down. And I said 4, you really need 3. The third one is, what are you gonna do about it? And that's where, when you look in your book and it says nursing management, that's what you need to be paying attention to. What is your response to what's going on with that child? If they have diabetes, what's my response? Am I gonna teach them? Am I going to assess their blood sugar? What is the question asking you? So when you look at cleft palate, reflux, and pyloric stenosis, there's 4 questions. Remember that all 4 of those things, this was from the nutrition lecture, have to do with the child having an interruption in their nutrition. So basically know that cleft palate can cause them not to have a good suck. It can also look debilitating to parents, so it can affect them emotionally. So what are you gonna do to feed that baby if they can't get a suck? So what's the nurse gonna do? And how's she gonna respond to the parents? How's she gonna educate them? And same thing with the tracheoesophageal fistula and lead poisoning. There's just 2 questions, so there's probably just 1 each on those. Down below, you'll notice under the the drugs to know that there's a chelation therapy. That should ring a bell when you're looking at one of these conditions, that how you're gonna use that and when you're gonna use that. So just know your meds, know the 3 things about all your conditions: what it is, what does it look like, and what am I gonna do about it. Nutrition, we talked about that with the diabetes and feeding the baby. Diagnostic tests and procedures, can't remember if I have any of those or not, but if I gave you any in lecture, know them. Priorities, that's always what we want to know. What are you going to do first? If the baby has this situation, a child has this situation, and then you look at the things, the criteria, what is going to be your priority? So just make sure you're reading the question carefully so that you are actually answering the question and not just spitting out what you remember from the book. Make sure you answer the question, not just your memorization. I will pause. Does anybody have any questions? I know it's tricky getting up here and getting to the microphone.
Did I miss anything
Okay.
around, the pediatric education and safety?
Uh-huh.
Did you go over anything on that? I don't know if I missed it or not.
Well, we talked about newborn and pediatric education and safety, so yeah, we talked about poisons, we talked about, different issues that children get into, so when I gave you those notes, go through those. I'm not gonna tell you exactly what's on the test, but just make sure that if I mention something in the safety and security or the nutrition lecture about that, go ahead and learn that. Make your cards, if you make cards, make your cards up for each subject, but make sure you don't put a lot of information on each card. If you have a study group, please study with your study group, but assign parts. Don't just get together and talk about it. That can be helpful, but make each other teach each other.
Same question for, was the smallpox
My question-
vaccine or was
Okay.
it the disease?
My question is about, newborn blood sugars. From what I've read the book, it's conflicting others, so what is the normal range for the newborn blood sugar?
Okay, there is a conflicting range. So we're gonna say, you're gonna check the blood sugar, you're gonna feed the baby. If it's less than 30, we get really concerned, but the pediatricians themselves can't even come up with a range. But if it's even low, we feed the baby. We don't wanna, oh, it's only 31, he's okay, right? No, we're gonna feed the baby.
What is low?
That can fix most of their problems.
Do you go ahead and feed the baby formula if the mom is not producing anything?
That depends. I know you love those kind of answers. You're gonna try, and if she doesn't, and I'm telling you what we did at every institution's gonna have something a little bit different. If we have to, we're gonna give her a formula. We're gonna try to get her to come from breast otherwise, but yeah, we want her to try to be able to feed the baby, but yeah.
Okay,
Yeah, but like I said, don't worry about that, because every institution has their own policy. So So just know, we check a blood sugar, we make sure that baby's eating, and that they can keep it down.
I think we said 2 levels.
Any other questions?
We have 2 levels.
I'm hearing something.
No, that was me, sorry.
Oh, okay, so sorry. Just guys, remember, please, please, please post your questions to discussion board. If you even have a thought, post it to discussion board, and then check discussion board. Because somebody else may have asked a question that you want the answer to, go and look at it. A lot of times, there's a lot of really good hints in there. Please, text me, you have my phone number if you do post, because I may not check it on the weekends.